Good afternoon and welcome to the Dothan-Houston County Joint Information Center. We wanted to take a moment today to provide an update specifically on Dothan and Houston County. We've been seeing the reports that come from the Alabama Department of Public Health. We've put out weekly updates through the Joint Information Center. We were doing those initially 3 times a week, and we've backed that down to once a week as we've moved forward through this. However, there's been a lot of discussion about number of cases increasing and what the impact is locally versus statewide and nationally. And so our policy group that meets weekly wanted to get together and bring the experts together to give our community an update on exactly what's going on locally. So this afternoon we brought together a group of experts to talk to us about what's going on here in our community. I would ask that we allow them to present, and then we'll bring them back up for specific questions toward the end if you have those after everyone has presented. So I'm going to welcome first Chief Medical Officer from Southeast Health, Dr. Charles Harkness is going to talk with us.
Good afternoon. Since the beginning of the COVID-19 pandemic, we have remained committed to sharing information with the public regarding COVID-19 cases and trends. We believe this level of transparency helps others make informed decisions, promotes safety and community health. At the end of April, we saw a decline in the number of hospitalized patients with COVID-19 in both local hospitals. This downward trend was reassuring, and it appeared that efforts to slow the spread of the virus were indeed working. At the beginning of May, the numbers started to rise again, and the number of hospitalized patients with COVID-19 increased. It appears we are heading for a new peak. Our initial wave of COVID-19 patients came from Georgia, especially Early County. Once we got over that first wave, we did see numbers start to decline. However, this most recent upswing is coming from Alabama, especially Houston and Henry counties. Southeast Health and Flowers Health Hospital opted to share this information jointly to give our community a clearer picture of the shift. This increase in COVID-19 has not caught us off guard. We remain prepared and ready to safely care for COVID-19 patients, as well as any other patients who need our care. At Southeast Health, we found a majority of our hospitalized COVID-19 patients are in 3 categories. First, African American, 80%. Female, about 58%, and then the last demographic is that the age is 59 years old. And this has not changed significantly over time. I want to make sure I'm clear on this point. Southeast Health is not advocating for a return to stay-at-home orders. We are advocating for businesses, churches, schools, municipalities, and counties to adhere to recommendations by public health officials and take steps to operate safely with community health in mind. It is important to get our economy moving again, and we really want to return to a type of normalcy. In fact, we are in the process of safely reopening the hospital to provide our patients with the care they have come to expect from us. We do want, however, people to be thinking of the threat of COVID-19 is not over, because it is not. Some of the ways we are providing safe environments for our patients are our staff and patients are able to and are required to wear, when they are able, masks and face coverings while in the facility. We're testing all patients as they come in, as well as those that are scheduled for elective surgery and outpatient procedures. COVID-19 patients are cared for in a designated area. We screen patients and employees before they enter the facility and clinics. We're offering people virtual appointments in our primary care offices and urgent care clinics. We practice social distancing, even in our elevators, and we use proper hand hygiene. We also believe it is imperative that each person take the proper safety precautions when in public. Always wear a mask, especially when you are in social settings with large groups of people, such as the grocery store or church. Social distance, meaning keeping 6 feet apart whenever you can from other people. Use hand hygiene sanitizers often, wash your hands with soap and water, and if you're sick or running a fever, stay at home. We have to continue taking this seriously, not only for ourselves, but for those who come in contact with us on a daily basis. For a high-risk group, we recommend you stay at home as much as you can. Our commitment to you, the public, is we will continue to be transparent with our numbers by updating them daily. We will continue to provide you with the latest information and guidelines from CDC and the Alabama Department of Public Health. In closing, I want to thank the City of Dothan, Houston County, EMA, and the Houston County Health Department for supporting both hospitals to ensure residents continue to be informed and educated about COVID-19. I'd be remiss if I didn't thank the media for your support. Every time we have called on you, you have not hesitated to step up and help us get the message out to the public. Southeast Health exists to promote health, prevent disease, educate medicine's brightest minds, and bring wellness and prosperity to this region. If we can continue to work together, we have no doubt that wellness and prosperity will return in the near future. Thank you.
And next, representing Flowers Hospital is their Chief Operating Officer, Mr. Matt Blevins.
Hello everyone, my name is Matt Blevins. I'm the Chief Operating Officer at Flowers Hospital. I want to thank you all for the invite today. Throughout this pandemic, the health and safety of our patients and caregivers has been our highest priority. Numerous precautions for infection prevention, access control, social distancing, and patient flow are in place to maintain a safe environment of care. Everyone who enters the building, including staff, is screened, and all employees, physicians, and patients are expected to wear masks. Waiting rooms and other public areas have been rearranged to maintain appropriate social distancing. Cleaning and disinfection of frequently touched surfaces and caregiving spaces has been intensified. Visitor restrictions remain in effect, and entrances to the hospital are limited. Flowers Medical Group offices are taking similar precautions, and telehealth appointments will continue to be available for visits as needed. We are working diligently to keep every patient safe, and we want our community to know that it is safe and necessary to seek immediate help in an emergency department for serious health emergencies like chest pain, heart attacks, strokes, and other life-threatening conditions. It is also important to reschedule healthcare procedures that have been delayed so health conditions do not deteriorate. Patients can be assured that we are taking every precaution to protect them. To help answer other questions about seeking care, a list of frequently asked questions has been added to our website, flowershospital.com. Thank you.
From the Alabama Department of Public Health, the Southeast Division, Mr. Corey Kirkland.
Good afternoon. I'm Corey Kirkland. I'm with the Houston County Health Department with the Alabama Department of Public Health. As the number of coronavirus COVID-19 cases increases in the state, the Alabama Department of Public Health urges Alabamians to practice social distancing and wear face coverings in public to stop the spread of COVID-19. According to the Centers for Disease Control and Prevention, social distancing means keeping a space between yourself and others to reduce the chance of contact with people who carry COVID-19. People often carry the virus without knowing it and may either be pre-symptomatic or without symptoms altogether. COVID-19 spreads mainly from person to person through respiratory droplets produced when an infected person coughs, sneezes, or talks. These droplets can land in the mouths or noses of people who are nearby and possibly be inhaled into the lungs. Studies and evidence on infection control report that these droplets usually travel around 6 feet or about 2 arm lengths. To help stop the spread of coronavirus, avoid large gatherings, maintain a 6-foot distance and maintain a 6-foot distance from other people. CDC also recommends wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain, such as grocery stores, pharmacies, and gas stations. While cloth face coverings may not protect the wearer, they may keep the wearer from spreading the virus to others. They provide an extra layer of help to prevent the respiratory droplets from traveling in the air and onto other people. Cloth face coverings can be made from household items and been made very cheaply as well. While most people should use face coverings, those who should not wear them are children under age 2, anyone who has trouble breathing, is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. Also remember other recommendations to help prevent the infection with COVID-19. Wash your hands often. Avoid close contact with people who are sick, even inside your home. If possible, maintain 6 feet between the person who is sick and all your other household members. Lastly, clean and disinfect frequently touched surfaces daily. This includes tabletops, doorknobs, light switches, countertops, handles, desks, phones, anything that someone may share, anything that's commonly used within the house. If surfaces are dirty, clean them. Use detergent or soap and water prior to disinfection. Then use a household disinfectant. Most common EPA-registered disinfectants will work against COVID-19. Thank you.
And last but not least, of course, from our local perspective, I would ask Mayor Mark Saliba and Chairman Mark Culver to come forward and talk from the local government side.
Thank you, Chris. Mayor, you've heard the information that the hospitals and health department have given, and the mayor and I want to appeal to our citizens. This is not a press conference we wanted to have today, but the information that we've been given that has shown the increases you have heard, and to us, most importantly, or at least to, I think, to our constituents, should be that those increases are now not those folks coming over from Georgia, but they're us. They're folks from Houston County and Dothan. We've got to take the right actions to make sure this spread and this increase doesn't continue. Ever since whatever the date was when the governor basically opened everything back up, I think we have seen some complacency out there. We've got to avoid that complacency. We've got to wear masks. We've got to maintain social distancing. This disease is still among us. It's growing at an alarming rate. We've got to do the right thing. At the county, we're asking, mandating all of our employees to wear masks, not so much for their protection, but for your protection when you're coming in there now. We want you to do the same thing. We're trying to set the example, as are the city and the hospitals, that it's important to wear those masks. We want you to do that out there. We're not just asking people to follow CDC guidelines to hear ourselves talk. There's a reason for it. We're trying to avoid the spread of this virus. When you wear your mask, wear it properly. I've seen a lot of people that are not wearing them properly. Be sure you have your face and nose covered. The guidelines are easy to follow. We don't know how long this is going to last, but we've got to take the proper actions to be sure our people are safe. So we're just coming to you today asking you to please, as citizens of Dothan, Houston County, and the Wiregrass, to do the right thing. Let's stop this increase that you've heard from the hospitals and to do the right thing and help our citizens stay healthy. Mayor?
Thank you, Chairman Culver. First, I want to say thank you to our hospitals, both hospitals. Thank you to Corey Kirkland with the Department of Public Health. Thank you to all of our emergency responders that are out there every day. We forget about them a lot of times, police and fire and those that are answering the calls, your calls that are emergencies, and coming up on sites not knowing who may have the virus and who may not. And so I want to say thank you for all that y'all do. You're doing heroic work, and we are gratefully appreciative as a city and a county. I want to continue to reiterate what Chairman Culver has said. You know, I think that I think all of us, are suffering from COVID-19 fatigue. We're tired of living out lives that are not like we're normally used to doing. And in our city and in our county and in this state, we like our freedoms. We like to do the things that we want to do. That's just who we are as a people. And I understand the frustrations. Lord knows I understand the frustrations, both from an economic impact as well as a medical one, as well as recreationally, being able to do the things that we're able to do, from our kids that are graduating from high schools, and all of those issues that you see and hear about on social media. We understand that. Chairman Culver and I are born and raised in Dothan, Alabama, and we love this city, and we have family, and we have friends and grandchildren and parents that are here as well. And we want to do what is the very best proportional response to what's going on in the city. And so we're asking everyone to please consider that this is serious, that this is something that we should take. It's nothing to sneeze at that 100,000 people in the United States have passed away to COVID-19 related deaths. That's a big number. And when we're talking about our people here in our city, in our county, and our Wiregrass, that means a lot to us. So it's not only for protecting yourself, but it's protecting those that are the most vulnerable in our city, in our county, those that may have deficiencies in their immunity, that may have some chronic illnesses, they may have some that we're not sure that they have, that they don't even know about. But this virus has a tendency to find those people and cause them to have the worst case of the COVID-19. So when you're in public, this is just common sense. When you're in public somewhere, in a big box store, in a grocery store, a small store, and you can't do the social distancing or the physical distancing, as they like to say now, if you can't do that, have a mask and put on a mask. It's not only for yourself, but it's for others as well. Now, this is extremely important to us, just like your job is extremely important to us, just like your children are extremely important to us. Your parents, your grandparents that are in assisted livings and nursing homes, they are important to us. And we just felt like it was time for us to step back in front of you and make sure you know where we are as a community. So I think at this time, Chris, will you ask questions? Or?
Yes, sir.
Okay.
If anyone has specific questions, if you'll identify who the question's for, we'll do our very best to repeat that so that all of the different outlets can pick that up. They have trouble hearing. So we'll open the floor to questions at this point.
Chris.
Yes, sir.
As it pertains to the hospitals and their visitation policies, a lot of times we hear from people that are not able to go with their loved one into the hospital. They're not able to be with critically ill patients who may, have need of their family members. Is there any plan for even one of the hospitals, is there any guidelines or anything like that that would allow such a thing as for some close relative to be in the hospital with their sick?
Dr. Harkness. The questions regarding having family members with someone who's hospitalized.
Yes.
It's limited currently.
Yeah, it's limited. Actually, the governor has told us, has set the guidelines on that. So the visitation, I don't think we're going to see that change probably till sometime in July, early July. So right now, it is what it is. The one group of patients that we change on related to the visitation policies, if somebody is in the process of dying, we don't want them to die alone. But I can tell you, I've had personal experience with this. Couldn't visit a loved one who was in the hospital, and that's just the way it is. We have to protect the healthcare workers, because if we lose them, then we're really going to get behind the eight ball. So that's why there's policies in place.
So there's no way that someone can come in with all the procedures in place as masks and gloves and sanitation and all that. They still can't come in.
That's correct. Still can't come in.
Okay.
Next question. Yes, sir.
These are 2 questions for Flowers. If there's a Delta at Flowers, how will that be reported? And how many people are hospitalized at Flowers?
So there's a question, how many people are currently hospitalized affected by COVID-19, and how are they reporting the deaths?
Correct.
Yeah, from the beginning, we made a decision not to report on a daily basis or give that level of detail out to the media. We are reporting 3 times a week to Houston County EMA that data, and they are getting that into the right hands. We're also obviously reporting that data to the state and to the CDC.
Question for Mayor Saliba, Chairman Culver, or both. And I understand that you do not have the authority to order people to wear masks. However, as you know, Mayor, that's something that has been urged repeatedly. Last night, I went to a major retailer. Out of 100 people I counted, there were 43 people wearing masks. I don't know if that's indicative of what we would see every day. What would you say to these stores in urging them to, if not force their customers to wear the mask, certainly to strongly encourage them to do so?
Okay. There's questions about people not wearing masks in public and how we encourage that.
Yes, thank you for the question. And I think to, again, reiterate what the urgency is we would strongly encourage companies that are open to retail or especially retail, and to encourage not only their employees but anyone that's coming into the store to wear masks. You know, I'm a very transparent kind of guy, and I get a lot of calls that are, I'm really scared. How can you enforce it? Make them wear masks. I get as many calls on the other hand that feel like that they haven't seen it, they don't know anybody that has it, and they don't understand why they have to wear a mask. But I think that prudence and good common sense is something that we all should be taking into consideration. And so I would urge those that are out there, especially in the retail, to ask their customers to wear masks. Just ask them to.
Do you share the opinion that Dr. Harkness shared earlier? You're not advocating at all that we go back to closing down businesses, and I'm talking the state.
Correct.
The city certainly can do that, closing down businesses. You want to move forward with business, but do it in a safe manner, if I'm understanding.
And that's exactly correct. I think we are in a new place. We have to find some new normals. We have to find some ways to be able to work, to recreate, to have family time, to socialize. There are reports out there that if you quarantine too long, that it causes other health issues as well, and we're very, very mindful for that. I do think that we have to make a living. People have to work, and so we have to find ways to work through where we are. I don't advocate going back to that, but I think that's part of the reason why we're here today, is to say the more that we can continue to do this type of stuff, the less of a chance that someone else would consider that. Chairman Cole?
Can I tag on that? Yeah. We've been operating at the admin building for the last, 2 weeks under a procedure asking everyone to wear a mask, and have really had no issues. If somebody doesn't have one, we've been issuing them one at the door. And again, it's not so much to protect our employees, but as to protect the people that are coming in and their families when they leave there. I think once you do it, and once people understand the distancing that is going on there, I think most people accept it and will not cause any issues. 40, I forgot who just said how many they saw at,
I did.
yeah. I mean, that's a pretty good rate. The last time I've been to the grocery store, it was nowhere near that many. I think complacency or COVID fatigue is a very good term that we're going through. We just want our citizens to realize that this is a significant issue. We're trying to set the example at the city and county and hospitals. These guys deal with it every day. If anybody should know what we're dealing with, it should be them. Follow their example. Use masks. Use social distancing, and hopefully we'll get through this without one single death is too much. And we possibly have more than that. So.
I'm going to try not to delay this press conference, but you make a very interesting point in the fact you talked about the administrative building.
Yep.
And people have not rejected or pushed back on using the mask. You have masks at the door. If they don't come in with a mask, you'll give them one.
Correct.
Why can't we work with retailers to see if they would make those masks available at the door? It may be that people are not opposed to wearing them, they just don't have them with them. Is that something that's even possible?
Well, I'm sure it's possible, but I don't know that it's something that government wants to mandate. I think we can certainly ask, as the mayor just said.
No, I wasn't suggesting.
Yeah.
Sure, I know you know how to.
You're right.
But perhaps talk to them about those masks.
No, they're not. These masks are relatively inexpensive, but it is a cost, and certainly, particularly in the big box places where you have a lot of people, that decision comes from who knows where. So, but I don't think there's anything wrong with us talking to them and asking that. It doesn't take. Of course, everybody can't have a deputy at the door like we do either. So, or a policeman. So, we do have some advantage that way, but it's a good service and is being received relatively well.
I've got two more brief questions. One for Mr. Chairman and Mr. Mayor. Are you privy to any numbers about our April sales tax figures that'll be coming out any day? I was hoping maybe you were privy to information we're not yet privy to.
Go ahead. I'm sorry.
Yeah, for ours, no. It should be the end of the week, and should have that.
And one more question for either Mr. Blevins or Dr. Hargis, either one vote. Are you guys surprised by what you're seeing figure-wise? With it coming back up?
The question was, are we surprised at the hospital operations level by the number of COVID cases increasing? I don't know if I'm surprised. I think it's interesting. You see in the graph behind us that early on we had a higher incident rate here in our hospitals of patients coming out of Georgia, and then it has swung. The number of cases coming out of Georgia has dropped off, and it has increased in Alabama. I do think that's interesting. Maybe that's because it was seeded at a later time, kind of by a patient zero. Maybe it's because of population densities being different. Maybe it's because of other socio-demographic factors. I'm not an epidemiologist. I don't have all the answers as to why we're a little bit behind maybe some other areas around us. But certainly it's interesting, and we're going to do our best to react to that.
Well, we were behind at the beginning of this. Georgia was ahead of us. Is that correct? It was more prevalent in South.
The data seems to show that. Yeah.
And one more thing, IHME actually predicted this surge. So this doesn't come as a surprise. There's always been projections out there that we weren't going to crest until mid-July. What's your late June? What's your prediction?
Well, I've seen a lot of different models, and obviously we keep a close eye on all of those, but have to take all of them a little bit with a grain of salt. I don't think anybody has a crystal ball as to exactly how this is going to play out. So what's important is that we just are proactive and take the proper measures to adjust to this as it unfolds, and that we keep everyone safe here in the Wiregrass.
Thank all of you for taking my questions.
Thank you.
Chris, I had somebody that sent in a question that where's the data showing a mask makes a difference? Like and this is them, not me speaking, says, I've seen data showing N95 mask or insufficient cloth mask are far less effective. It is what it is because the governor says.
Okay,
Does
so
anybody can comment about the mask?
the question is, why wear a mask and why have the 6-foot distance? Dr. Harkness, if you'd like to address that, and then behind that we've got a question for Corey Kirkland, and then I think we'll wrap from there.
The fact is, we've watched this happen. The mask has become more important, not less important. Initially we were talking about the virus on surfaces. We have not seen it either locally or nationally being passed from a surface to a human. We're seeing it, and we've seen it in the hospital. We're seeing it happen with direct contact, and it's the air droplets that are the problem. So the mask, yeah, it's not 100%, but if both people are wearing a mask, the person who has COVID and the person who's coming close contact with them, even 6 feet, if they both have a mask, the chances of those droplets getting from the COVID positive patient to the person that doesn't have COVID drop significantly. So we feel strongly that the masks are maybe the single biggest factor, along with the 6-foot distancing, in terms of preventing the spread of this disease.
Okay. And then one last question, I believe, for Department of Public Health.
Can we expect some kind of numbers for as far as like counties in the Wiregrass recovery numbers, and if so, when?
Specifically recovery numbers based by county for the Wiregrass region.
There is a section on the dashboard that has recovered patients on it. I know that our IDNO staff, which is our infectious disease staff, is working on some more reports. I do know that recovered patients is one of those categories that they are working on, so I would think in the very near future we should be able to start breaking that down by county. So we are working on that question.
Just one last thing to say. Again, want to say that I think Chairman Culver and I both feel like this proportional response is extremely important. I want you to know, too, that it's not just this part of it that we're concerned with. We've just spent almost 2 hours ourselves talking about how businesses can recover from this as well. So even though you see us having this press conference now, encouraging you to wear masks, the importance of our economy is extremely important as well. And just like the hospitals, they're getting back to some of their business as well with elective surgeries. People don't need to put off things that, especially if they're chronically ill, they don't need to put those off. That the hospitals are safe to go to. Our places of business are safe to go to. We have to get back to some normal life with some common sense as well. And so know that everyone here and everyone that's involved with both the city and the county and your commissions, county commission, the city commission, are all concerned about our citizens and how they're working and who's not working and who's able to get this virus, who's more vulnerable to it. Your children, are they getting to play? Are they getting to play ball? And all the things that are out there that are normal is extremely important to us. And we're continuing to work on that day in and day out. So again, I want to thank the media and all of you that report this as well. And thank you, sir.
All right. That will wrap us up for today. Again, thank you to our media partners, to everyone who helps us get the message out. Remember, wear the mask, socially distance, good hygiene, and we're talking about physical distancing. Remember, and I say this every time, remember to check on those in our community that are most vulnerable. If there's something we can do, if you have an elderly neighbor or family member that you can pick up their groceries for them because you're healthy and leave it at the doorstep, help those that you can in our community. That's what the Wiregrass is known for, is taking care of each other. So thank you for your time, and we appreciate it.